This is Haley Hopper, the lead physical therapy preceptor with AW Healthcare, and today I'm showing you how to do a PT visit note. So this is for PT or PTAs. This is a regular visit note. So here we're on our daily timesheet. We're going to go to eChart to start our note. It will ask us to clock in. Okay, so starting from the top with incident report, if the patient's had an incident since their last visit with any discipline, whether that's a fall, a change in medication, an infection, anything along those lines, we'll need to click yes and then report the incident. If not, you can click no. We'll need to select 3 patient identification options: patient tolerated session well, and standard precautions observed. If we don't click these things, it won't let us submit the note later. Moving along, skip functional assessment. We get to our subjective. A lot of this is pretty straightforward, but again, you can always use the quick text options. It'll either say PT recommended documentation or PT/OT recommended documentation. Plan from prior visit will give you a heads up of what either you wrote or the therapist before you wrote as the priorities for this visit. And then the best practices plan from prior visit. We'll obviously want to address mental status, any education and patient education. We want to document any education we provided. On this main note page, we're going to keep things pretty simple and pretty brief. We're going to get into more detail on our interventions in the interventions tab. So we may have discussed the exercises, pain management, energy conservation. Again, for a lot of these, you can use the PT recommended documentation quick text, which will help give you some guidelines on what we're expecting in these areas. So make sure what you've clicked is appropriate for the patient you're seeing. We'll go over here for vitals. In home health, we need to document vitals, heart rate, oxygen, temperature, respiratory rate, and blood pressure. And I'm going to make the blood pressure high because it will alert you if the blood pressure is outside of parameters that you need to contact the physician. Anytime vital signs are outside of our regular parameters, we need to contact the physician, document that we contacted the physician, and document any changes the physician may have made to the plan. Normal vital ranges will be listed here if you don't know them. Okay, then we'll go down here to pain. Usually we'll type C. Wong Baker, and then you could click here and it will bring up our pain assessment. You'll need to fill out a Wong Baker at every visit. It's required even if the patient doesn't have any pain. So I'm going to go down here. We're going to say this patient doesn't have pain. And that's within the last 24 to 48 hours. If they've had pain in the last 24 to 48 hours, we'd want to make sure that's expressed on this form. We're going to save and submit that form. Okay. Over here, COPD and CHF protocol. These are required to be addressed if the patient has either of these diagnoses. If they don't, you can press NA. If they do, comment on something therapy appropriate related to that diagnosis. We'll have some recommended documentation here of things that you may educate the patient on or ask the patient about related to that diagnosis. Okay, going down further, medications. So we need to ask the patient at every single visit, or the nurse, if any changes have been made to the medication. So again, PT recommended documentation. It'll walk you through it. The patient caregiver were asked about changes to medication. Patient caregiver deny or report changes to medication. If changes were made, you'll need to list the prescription number and report it to the supervising therapist, and they will update that on the patient's med list. It requires an order, which is why it will need to go to the supervising therapist. Other treatments. For these, again, keep it general. What we recommend is, for the PT recommended documentation, is just to write C interventions. The reason we do that is just to avoid duplication, because we're going to address these things later on in the note in the interventions tab. Now, if you didn't address it at all, you can click NA. There's nothing wrong if you put things in these boxes. It just is, again, extra work for you. So back over here to this side, to homebound, you'll have to say, yes, the patient's homebound. Why are they homebound? And not only will you have to select these, but you'll also have to comment. So this is an example. Again, you don't have to use that one. Behavior, pretty simple. Are they cooperative or not? Impaired safety. If they have any environmental limitations. If they don't, you can click NA. If they do, you may want to talk about any education provided either here or on the interventions. Personal safety. Okay, assessment and patient's tolerance with the treatment. This is important. It's a requirement for home health. So we'll need to say that they understand goals were discussed and that they are progressing toward goals, and that the patient understands the discharge plan. Even if we're not discharging at this moment, this just means that we talked about work with the patient, that we're working towards their discharge, especially if they're due to discharge soon. Case conference, if you spoke with any other clinicians or if you documented anything in your care coordination note, you'd want to select who you communicated with, or if you communicate with the doctor, notified of vitals outside of parameters. Okay. So supervision program. So if you are a PTA, you do not need to fill this out. So again, this kind of gives you guidelines, those quick text options. If you are a PT following a PTA, you can complete this if you'd like. This can serve as a supervisory visit, so that every day or every 30 days supervisory visit that's required, you can do that here and just fill it out appropriately. So I'm going to say actually not applicable. Plan for next visit. This is where you want to talk about what your plan is for the next visit. And this is especially important if you're going to be followed by a different therapist. Best practices be followed. Again, we have the recommended documentation. These are a lot of the options that you may use. Delete the ones that aren't appropriate. Add any that you think need to be added. Today's notes. Any additional information that does not fit elsewhere. And then this is care coordination. So again, you'd probably want to write MD notified of elevated BP. No immediate changes made to plan. Okay, So then we are toward the bottom of our note, but now we're going to go back to the Interventions tab. We're going to first save. You always want to save before moving between tabs. So here's a good spot to maybe go to your Forms tab. So we already filled out the Wong-Baker. That was built into the pain section, but we also need to add an HHA COVID screen. So add new form, HHA COVID screen. Fill that out appropriately. And sign it there at the bottom. Save and submit. Okay. For visit notes, you're not required to do any outcome measures, but you do want to have the Wong-Baker and the COVID screen form. Now we're going to go to our Interventions tab. This is where you'll write the bulk of your interventions that were performed during your visit. These visits, or these interventions here, weren't really edited, so bear with me, but you're going to perform interventions. Click the intervention. This is the COVID screen intervention. So let me say screening done. Let's see. Education provided, ... You know, you may talk about the exercise program. The cues provided, you know, all the details of your treatment. Make sure these are detailed. They should include distances, assist levels, devices, gait pattern deviations, any details of your treatment you'll want to include here. You're going to save and close when you're done. Remember, if it's not documented, it didn't happen, so please document those in detail. Okay. And then we also ask that you address the Goals tab during a visit. So this part doesn't need to be detailed. So for example, for a gait goal, under interventions, you may write the patient ambulated 250 feet with min assist with two-wheeled walker, decreased step length noted, wide base of support, required cues for this, that, and the other, improvements noted with blank. So the details are going to be in the interventions. In goals, you can keep it very brief, like ambulated 250 feet, min A with walker. Just something to address the goal. So we're just kind of keeping tabs on the progress of the patient, and we also just want to note that we're checking the goals every visit to make sure we're addressing all of the goals. Okay, you don't need to address every goal at every visit. Just make sure each goal is addressed sometime during the episode, and that you address any goals that are appropriate. So interventions are detailed, goals are very brief. Just a quick status update. Okay, after you're done with that, again, when you're switching between tabs, make sure you save. We're going to go back to the visit. And we're going to go ahead and get ready to submit our note. We're going to have to go back down to the bottom. Clinician's signature. Scroll back up. Submit to QA. So we're going to say our timeout is 11 o'clock. And then it'll cue you about the blood pressure. So yes, the physician was notified, the nurse may be notified, or other staff within that care coordination note. So MD notified, no changes made, see care coordination note. And then you're going to continue. And then your note is done. So that is a regular visit note for home health, for physical therapy. And that's it.